Hi, this is Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon operating in Aestiva Cosmetic Clinic, Saket. Today we're going to be talking about the various surgical options available to correct the changes brought about by aging in the face. So as a person approaches the age of 45 to 50 years, a variety of combinations of procedures have been designed to correct facial aging. Now these include a brow lift for droopy eyebrows, a facelift for facial sagging and development of folds over the face, and a necklift to correct the changes of loose skin and deficient jawline definition which is brought about by aging. So who is an ideal candidate for a surgical facelift? Anybody who is in the age group of 45 years and above can be a candidate for a combination of procedures to correct aging. Now, people who have a droopy eyebrow or people who have developed loose folds over their face, have deep nasolabial folds, or have loose sagging skin over the jawline, creating the presence of jowls and absence of a jawline definition. These are the ideal candidates for procedures which are surgical to reverse these changes. Surgical procedures when it comes to treating facial aging are tailor-made to each patient. So for every patient we assess the need of the patient and which procedures are required, which procedures can be tailor-made a little differently depending upon the changes which aging has brought about on the individual's face. So this surgery can be a combination of either a simple facelift or a facelift along with a neck lift, a facelift along with a brow lift, or a forehead lift. Depending on this, the duration of the surgery will differ between say around 4 to 5 hours to maybe even 7 to 8 hours if a combination of procedures is used. Whatever be the combination, these procedures are always done under general anesthesia and usually entail a stay of about 1 day in the hospital setup. The recovery will again depend upon what all procedures have been done and also upon say the age of the patient and the general health status of the patient. In general, any person who is physically fit and has any comorbidity is still a good candidate provided that this comorbidity is well under control. So if a patient is a diabetic or if a patient is a hypothyroid and still wants to take care of these changes which the aging process has brought about, he or she can do that once these diseases are under control and he is on regular medications. So once we have determined what is the need of an individual patient, we will make a tailor-made plan for that patient. So say suppose we decide just to do a mini facelift which takes care of your jawline and of a little bit of looseness in the area of the neck, then this can be done in a time period of about 3 to 4 hours. Again, in the same sitting, we can address problems like loose skin under the eyelids or puffy eye bags. All this can also be a part of our facelift procedure. In some patients, we might require more extensive procedures like we might require a forehead lift for a droopy eyebrow or even a lift of the lateral 1/3 of the eyebrow, mainly in women. So, depending upon what all has been combined, the recovery from the procedure is also different for each person. On an average, the recovery from surgical facelift procedures takes about 2 weeks, after which the patient is able to resume all his activities. But if we talk of complete recovery in terms of complete resolution of swelling and complete resolution of bruising, settling of scars, then this can take up to 2 to 3 months also, especially if a combination of procedures has been used. The results which we can achieve using a combination of these procedures are highly satisfying for the patient. The patient can easily look almost 10 years younger when a proper tailor-made plan has been executed and the patient has followed all the post-op instructions properly, that is avoidance of exercises, a healthy nutritious diet, avoidance of weightlifting, and also following all the precautions like wearing a proper compression garment and avoiding alcohol and smoking. Now, these results are very long lasting compared to the various non-surgical modalities which are available, and also if you supplement them with other small procedures, say like for anti-aging injections in the form of Botox or fillers for fine lines, then these procedures yield satisfactory results for a period of almost 10 years. The scars also tend to settle very well with time and are generally placed in hidden locations which are socially acceptable and which are difficult to perceive at least at a conversational distance. So how do we maintain the surgical results which we have achieved once these procedures have been done? An essential component of this is maintaining a healthy lifestyle, avoiding excessive fluctuations in weight in terms of weight gain or weight loss, avoiding substance abuse like alcohol or smoking, and also sticking to a good skincare regimen which includes cleaning, toning and moisturizing, as we all know. All this will delay the development of fine lines and deep folds in the future. Also, we can also use other ancillary treatments like anti-aging injections in the form of Botox or fillers to supplement our surgical procedure. Overall, if the patient follows a healthy lifestyle, then these results last for a period of 10 to 15 years and are highly satisfying. If you found this video useful, please click the like button. For any further queries regarding facelift procedures, you can drop your comment in the comment section below. And if you like this video, please subscribe to our channel and hit the bell icon. Thank you.